Okay, so as we swallow food, it moves from the mouth into the pharynx, and remember that's what we commonly call the throat. The soft palate of the mouth and the uvula, remember that's the little hangy down thing, is going to push upward and block off the nasal cavity, so the nasopharynx is closed, so food can't push up into the nasal cavity. Also, when we swallow food, the epiglottis is going to close off the trachea, so the larynx and the trachea is closed, and food has nowhere to go except through the posterior oropharynx into the laryngopharynx, and then down into the esophagus, where muscle contractions are going to propel the food further down the passage. So let's move into the esophagus, which is a collapsible muscular tube about 10 inches long. It's posterior to the trachea. It begins at the inferior end of the laryngopharynx and pierces the diaphragm through an opening called the esophageal hiatus and extends to the superior part of the stomach. So the esophagus is composed of stratified squamous epithelial, areolar connective tissue, and smooth muscle. Near the stomach, the mucus layer of the esophagus contains a lot of mucus glands that are going to continue to lubricate that food as it passes through, protects it against abrasion and wear from the food particles that are being swallowed. The muscularis makes up about the muscularis of the top third of the esophagus is skeletal muscle. The middle third is skeletal and smooth muscle, and the inferior third is just smooth muscle. So at each end of the esophagus, the muscularis becomes a little more prominent, and it forms two sphincters. The upper esophageal sphincter, which consists of skeletal muscle, and the lower esophageal sphincter, which is made up of smooth muscle and is near the heart, so it's sometimes called the cardiac sphincter. The upper esophageal sphincter regulates the movement of food from the pharynx into the esophagus, and the lower esophageal sphincter regulates the movement of food from the esophagus into the stomach. So the esophagus secretes the mucus and it transports food into the stomach, but it doesn't have any digestive function because it doesn't produce any enzymes, and it doesn't carry on any absorption. So the esophagus is a passageway. The movement of food from the mouth to the stomach is called deglutition, or swallowing. It occurs in 3 stages: the voluntary stage, where that bolus of food is passed into the oropharynx; the laryngeal phase, an involuntary passage of that bolus through the pharynx and into the esophagus; and the esophageal phase, also involuntary passage of that bolus of food through the esophagus into the stomach. So swallowing starts when the bolus is forced to the back of the oral cavity and into the oropharynx as we move the tongue upwards and backwards, and it pushes against the palate. These actions are the voluntary stage of swallowing. The involuntary pharyngeal stage of swallowing begins after that. So it begins in the medulla oblongata, or as impulses are going to be sent from the oropharynx up to the medulla and the lower part of the pons in the brain stem. Those impulses then are processed, and returning impulses cause the soft palate and the uvula to move upward and close off the nasopharynx. That prevents the food from going into the nasal cavity. And the epiglottis closes off the larynx, preventing that food from entering the respiratory tract. So the bolus moves through the oropharynx and the laryngopharynx, and once the upper esophageal sphincter relaxes, that bolus can then move into the esophagus. Whoa, one too many. I swear this mouse is so touchy, guys. I apologize. The esophageal stage begins once the bolus has moved into the esophagus. During this stage, peristalsis, or a progressive coordination of smooth muscle contractions and relaxations of that circular and longitudinal layers of the muscularis, is going to push that bolus forward into the stomach. So that lower esophageal sphincter is going to relax when that bolus of food reaches it, and that allows the food to move into the stomach. Mucus secreted by the esophageal glands is going to lubricate that bolus of food and reduce the friction. The passage of solid or semi-solid food from the mouth to the stomach takes about 4 to 8 seconds. Very soft foods and liquids can move through in about 1 second. So this just gives you an overview or a summary of the role of the pharynx and the esophagus. Again, the things we've already talked about, but put into a nice little summary table for you. But I do want to talk just briefly about some homeostatic disorders associated with this. And we'll begin with gastroesophageal reflux disease, or commonly just called GERD, because gastroesophageal reflux disease is quite a mouthful. So if the lower esophageal sphincter doesn't close as it should after food has entered the stomach contents can reflux or back up into the inferior portions of the esophagus. So hydrochloric acid, that's part of the stomach, or some of the stomach contents, can irritate that esophageal wall, and that results in a burning sensation that we just usually call heartburn, because it's experienced in an area that's very near the heart. Remember that lower esophageal sphincter is sometimes called the cardiac sphincter because it is near the heart. But it's not related to a cardiac problem. It's just the burning from that acid. Drinking alcohol or smoking can cause the sphincter to relax, and that worsens the problem. It can be controlled by avoiding foods that can strongly stimulate stomach acid secretion. Some of those foods are coffee, chocolate, tomatoes, fatty foods, certain minty things like peppermint and spearmint, or onions. I know, right? I don't want to cut all that out. Sometimes acid-reducing strategies, such as taking over-the-counter medications like Tagamet or Pepcid, about 30 to 60 minutes before eating, can help to block some of the acid secretion or neutralize the acid that's already been secreted with antacids like Tums and Maalox and Rolaids. Symptoms are less likely to occur if food is eaten in smaller amounts and if you don't lay down right after you eat a meal. GERD, however, can be associated with cancers of the esophagus. A hiatal hernia occurs when part of the stomach protrudes back through the diaphragm, through that esophageal hiatus, hence the name, hiatal hernia. This can lead to constriction and may require laparoscopic surgery to repair.